Healthy gums, healthy body. Your bloodstream can take the bacteria in a gum infection all around your body and affect your heart, brain and joints, and even the health of an unborn baby in the womb. So, healthy gums are vitally important to your overall health. Yet nearly half of us will have experienced advanced gum disease at some point in our 40s, 50s or later. So what can we do to avoid it? I'll tell you all about that in just a second. But first, welcome to our channel. If you're new here, tap or click on the subscribe button so that you will always be among the first to know every time we upload a news you can use video to keep yourself healthy, happy, fit and slim. Now, about those gums of yours. When we think of dental issues, what usually comes to mind are cavities, corrective braces or a half day off work after having our wisdom teeth pulled. But the health of our gums should be much more on our minds. The most obvious symptom of gum disease is bleeding when you brush your teeth. Women, because of fluctuating hormone levels, may have more instances of bleeding gums at particular points in their menstrual cycle, when pregnant or during menopause. This can also be accompanied by red or swollen gums. The early stage of gum disease, with bleeding gums, is known as gingivitis. If left untreated, it will progress to become more serious. You may notice bad breath, a bad taste in your mouth, the loosening of teeth and even abscesses. This is periodontitis, where the tissues and bone that support the teeth are also infected. It's periodontitis that causes teeth to fall out. Many people expect to lose their teeth as a natural part of the aging process. But that doesn't have to be the case, as gum disease is preventable. With good personal care and advances in dentistry, there's no reason why we shouldn't all reach old age with our own teeth. The days when 70-year-olds were wearing a full set of dentures are largely in the past. Gum disease isn't something to which most people usually give much thought. So, it may well shock you to discover that gum disease can also affect much more than our teeth. A gum infection doesn't just remain in your mouth. Your bloodstream will take it around your whole body. If you have type 1 or type 2 diabetes, you will find it harder to fight infections. And gum disease can hamper your ability to control your blood sugar levels. In the United States, patients with gum issues are required to see a periodontist before undergoing heart surgery. This is because the very same bacteria inflaming your gums can also affect your heart. Medical research has also linked poor gum health in pregnant women to preterm, low birth weights in their babies. Other studies have also linked gum disease to rheumatoid arthritis and dementia. In short, any condition elsewhere in your body that has a link to inflammation could be made worse or possibly even caused by inflammation originating from your gums. It is, however, easy to take care of the soft tissue in your mouth, although some of us are more susceptible to infection than others. Around 8% to 18% of the population will be genetically predisposed to gum disease. But the advice is the same for everyone. A balanced diet plays a large part. Think more vegetables and calcium-rich foods, less sugar and fewer fizzy drinks. But mostly, it's about cleaning your teeth properly. And that can sound like a criticism when you say it to people. It's also a problem, as nobody likes to be told they're not doing something properly. Especially if they've brushed their teeth that way since they were 4 or 5. I remember once being asked by a dental hygienist to brush my teeth in front of her after she had first made me swirl around in my mouth a purple dye which stuck to my teeth. After brushing my teeth in the same way I had been doing since childhood, I was utterly shocked to discover how much of my mouth remained untouched and how much of the purple dye remained. It turned out that while I had been faithfully brushing the tops and inward and outward sides of my teeth, I had been completely ignoring my gums and the base of my teeth where they meet the gums. As well as that, once every 3 months, I was having to undergo the painful ordeal of having plaque grinded off the base of my teeth and scraped off the sides of those teeth which were packed up tightly against neighboring teeth. And when, at intervals, I spat out into the dental bowl, literally what a bloody mess that was. So, how exactly should we be looking after our gums? Well, we should, of course, be brushing twice a day, for at least 2 minutes. First thing in the morning as soon as we get up, and last thing at night, just before going to bed. A manual toothbrush can be as effective as an electric one if used really thoroughly, with care taken to cover all areas of the mouth. Fun fact: did you know that dental hygienists can often tell if a patient is left or right-handed by looking at the mouth areas they have missed? As for size, bigger isn't better when it comes to toothbrush heads. A small head with medium, round-ended bristles would be more useful. But cleaning with just a standard toothbrush is not enough. To prevent gum disease, you also have to clean the spaces between the teeth. That means interdental floss if you have tight gaps between your teeth, and interdental brushes if you have bigger gaps. As many of us have gaps of different sizes between our teeth, you may well need both floss and interdental brushes. And quite possibly interdental brushes of different sizes. So, to recap, good gum health can guard against heart disease, dementia and rheumatoid arthritis, help you to manage diabetes, increase your chances of having a full-term pregnancy and a healthy baby. Oh, and one last thing. It can also keep your breath fresh and stop your teeth from falling out. So, remember, think twice about what you are putting into your mouth. Eat healthy natural foods such as fruit and vegetables and avoid processed foods and sugary drinks. It is especially important to train your children's minds about good gum and dental health, and not condition them to think of fizzy drinks as a treat or reward. And when it comes to cleaning your teeth, no matter what toothbrush you're using or whatever adverts may claim, evidence shows that nothing cleans between the teeth better than floss or an interdental brush. Simply brushing with a standard toothbrush is nowhere near enough for good gum health, as there are so many nooks and crannies between your teeth where a regular toothbrush simply cannot reach. For those hard-to-reach spaces, only floss and interdental brushes will do. We hope you've enjoyed this video and that the information we've just given you will inspire you to stay or become healthy, happy, fit and slim. If so, please like this video and share it on your social media. And feel free to leave a comment below. Tell us what was the most useful thing you learned. And what topics would you most like us to cover in a future video? If you're new here, please subscribe to our channel, and click on the notifications bell, then the word, all, to make sure you are alerted about when our new videos are uploaded. Meanwhile, if you're still in a video viewing mood and want to watch more right now, click on our channel name below to take you straight to our other recent videos. All of which give you news you can use to help you stay or even become healthy, happy, fit and slim. Also, down below in the description, you will find a link to our entire video library, with the most recent first. Plus a second link to all our videos grouped by playlists, health, nutrition and exercise. Or how about the 2 video suggestions we have just put on screen for you? Tap or click on one of those now.